There's one Medicare decision that once you make it, you might not be able to ever change back. Not next year, not ever. And most people don't find out about this until it's too late. I've watched dozens of people lose access to coverage not because they couldn't afford it, but because they missed their window of opportunity to get on it. So before you make a single Medicare decision, watch this video because this is one I'd want my own parents to also understand. Hi, I'm Joseph Pate, better known as Medicare Joe, and we've helped thousands of people successfully enroll into Medicare. I'm going to go over 3 things very quick in this video: what the irreversible mistake actually is, the exact window of time that actually will trap people, and how to protect yourself before that window closes. Here's the pain point I want you to sit with throughout this video. Most people pick their Medicare plan based off of this year's price, based off of this year's health, but the rules don't care about what's going on this year. They track and care about your health, and the day you actually try to change your mind with your Medicare plan is where you end up getting trapped. So I want to kick this off with the story of a client named Linda. She's 68 now. She was healthy, active, walked every morning, and what she wanted was a $0 premium plan. Well, why wouldn't she, right? She's healthy, she's active. It felt like it was the right fit for her. And for 3 years, it was a really good fit for her because she barely used her insurance. But then what happened was she got diagnosed with a condition. So she called us to switch and make the change. And that's really where the floor fell out from under her. Here's the crazy part. When Linda tried to switch to the other coverage, they didn't just say yes. They asked her a bunch of health questions. They ran medical underwriting. They asked what prescription she was on. Because of her new diagnosis, they were allowed to actually say no. So I want you to think about that. The exact moment that she needed better coverage was the exact moment that she could no longer get said better coverage. The healthy version of Linda could have had any plan she wanted because she was in good health. The sick version of Linda was stuck with the plan she was on. So the question you really need to be asking yourself right now is, am I in that window right now? How close am I to that window? Because if that window closes on you, you might be stuck with the plan you have for life. So here's what's actually going on. The core problem here is that when you first become eligible for Medicare, you get a one-time enrollment window. That's called your open enrollment into Medicare, your initial enrollment. And during that window, you can choose a Medicare supplement plan, a Medicare Advantage plan. It does not matter. You cannot be turned down. There's no health questions, no underwriting, no matter how healthy or how sick you are. It does not matter. But that window will only stay open in most cases for the first 6 months of you being on Medicare. After that point, you can still make some changes if you're in good health. The second your health changes, we start to lose that freedom to make a change to that better coverage as we get more ill and as we age through life. That's the cruelest part. We don't know when that door is going to get locked on the other side for us where we cannot make a change because it's all based on our health. But let's say you already know which way you want to go and you're already leaning Medicare Advantage or Medicare Supplement. There's still a second trap that catches people off guard. And this is the one that is about timing. Because even people, when they pick the right plan, pick the wrong moment to enroll. And if you enroll in the wrong time frame, in the wrong moment, you can be charged lifetime penalties. So here's how you protect yourself from both of those situations. There's 3 things. Number 1, you need to know your window of enrollment before you actually need to utilize it. So the single most powerful time in Medicare is your initial enrollment into Medicare. This is the time you can choose a Medicare supplement plan with no health questions, a Medicare Advantage plan, change between the 2 of them, it doesn't matter, and there's no health questions asked, so we have maximum flexibility. Number 2, choose your coverage based on the future you, not just on your health and today's price. So I always tell people, don't just ask what's the cheapest this year. Ask what coverage do I actually want to have once my health changes and now I need this insurance to actually work for me. And then number 3, don't navigate this alone. Not because it's impossible to understand and go through, but because costly mistakes are here and a lot of people, you don't know what you don't know. So you can't see them coming because you've never lived them before, you've never heard of them before, you've never researched them before. A good independent agent does this hundreds, thousands of times a year versus people that do this once or maybe twice in their lifetime if they're helping a spouse out, right? That's not fair to go into this by yourself. And here's the honest truth. Most people in my industry won't say this out loud, but there's a lot of money in steering you in the direction of certain options over others because you'd rather keep your options open. You'd rather have flexibility, and you don't want to be steered in a direction. You want to be able to pick which option makes the most sense, again, for your health and the future you when you need your coverage. So if you know anybody, a parent, friend, coworker turning 65, share this video. Everyone deserves to actually understand this concept. And most people don't even realize that this window is a mistake that can happen to them just based on their health. If you want a free consultation to figure out your own window before it closes, making sure you're making the right choices, there's a link below. You can book a call with one of our team members. Otherwise, if you enjoyed the video, give us a like, subscribe to our channel as you'll be notified when we post new Medicare videos here to our YouTube channel. And thanks for watching.